FLOTE stands for Francis Lamont Orthopaedic Table Extension. It's a device that we've developed to facilitate a complex orthopaedic surgical procedure for hip replacement. Total hip replacement is one of the most successful orthopaedic or surgical interventions that's ever been invented. There are about 80,000 done every year in the UK, and the vast majority of them are hugely successful and life-transforming. Most of these surgeries are done using major incisions in the back of the gluteus maximus, the largest muscle in the body, and so there are consequential recovery implications in that. In the 40s, two French brothers, one a surgeon and one an engineer, developed an alternative method for hip replacement using a small incision in the front of the thigh. But it's not really taken off in great numbers because it's much more difficult for the surgeon to learn, and it's much more difficult for the surgeon to get confidence with. It also requires a larger number of surgical assistants to carry it out successfully.
And orthopaedics has always been at the forefront of reducing the extensive surgery with arthroscopic surgery, and this is just an extension of that. But it's been a bit of a holy grail. It's always been very difficult to attain, and this table seems to have just opened that door to less invasive surgery.
The direct anterior approach for hip replacement is more difficult for the surgeon, primarily because you're trying to do the whole procedure through a 6 or 7 centimetre incision in the front of the thigh. And in order to do that successfully, the surgeon needs to be able to position the operative leg in a number of predetermined orientations, rotations, elevations, and so on. Now, without FLOTE, it requires several skilled assistants to stand in one place for maybe 20 minutes, holding the leg, rotating the leg, pulling the leg, etc. With FLOTE, an easily trained operator can operate it to the right position so that it becomes a much more consistent, reliable, predictable procedure.
Its main features are it attaches to any other operating table. A lot of the big issues other tables have had is connecting to different types of standard operating table. And some of the other tables are the whole operating table, hence the expense and the difficulties in transportation. Secondly, it is much lighter for the technicians to use than other ones on the market. And thirdly, it is very radiolucent, which means we can take X-rays very easily. X-rays are possible with other tables, but they're a bit of a hit or miss. But this is designed specifically to be able to X-ray in theatre the whole pelvis.
Anybody who works in or is associated with the NHS in any way will be all too well aware that one of the key drivers for cost reduction is reduction in length of stay. And it's pretty clear from our evidence that the direct anterior approach to hip replacement using FLOTE can have a massive impact on length of stay in hospital.
The average length of stay in Wales was approximately 7 or 8 days. When I started anterior hip surgery, the length of stay dropped immediately to 4 days. When we started what's called prehabilitation, which is prompting the patient that the length of stay will be reduced, and the physiotherapist and the rest of the staff, it came down to an average between 2 and 3 days. It used to be that the patients were mobilised with physiotherapists. Now the nurses are quite confident about getting the patients up, who are up the same day of their operation. And we know length of stay in hospital has other adverse effects, such as hospital-acquired infection. Immobility produces venous thrombosis, and we think all these things can be reduced by early mobilisation.
I was in on the Monday morning, 7:30, operation the same morning, out the next day, 3:30, on crutches, and I was home. The National Innovation Centre of the NHS is going to sponsor
multi-centre surgical trial to evaluate and benchmark the technique and get to the bottom of all of the benefits, because they'll be wider than we immediately think they are.
I guess the operating table extension, or FLOTE as it's known, is typical of many innovations that are submitted to the National Innovation Centre. We respond by putting every innovation submission through a robust and rigorous assessment process. We have access to a range of expertise across the NHS and industry to help us undertake that assessment process. And the results of that assessment process was a recommendation to provide development support and funding to help speed up the development of this particular innovation and to get it into the NHS in a timely manner, and to make sure that that innovation was NHS market ready, so to speak.
MIS hip surgery is still a minority of hip surgery performed in the UK. It's growing in the States, it's probably up to 15% of the States, and parts of Europe it's dominant.
We've taken the machine in the back of the car to France, and surgeons who've never seen it before have done 5 hip replacements in a day. That's happened on several occasions. And it really is curious, because given that the technique was developed by 2 French brothers called Judy in the 40s, this is like coals to Newcastle. We've revised the technique, improved the equipment, and we're now selling it back to France.